Oh, hi, Dr. Tess. How are you?
Hi, Gary. How
Hi, it's
are
nice
you?
to meet you.
Great to meet you.
Thanks so much for joining me today.
No, thanks for having me.
Awesome. So Dr. Tess Mauricio, the founder, owner of M Beauty Clinic in Beverly Hills, right? You're a dermatologist,
Yes,
very decorated. You've been
thank you
on
so
many
much.
different shows and you have a fantastic reputation. So I really appreciate you being here today with me.
Yes, thank you for having me. And I'm excited to talk about, topics that obviously I'm very passionate about, aesthetic medicine, and,
Yes.
always looking for the cutting edge. And I know that you share the same passion. And also, I want to congratulate you for really using your platform to educate, inspire, and create awareness. I know that you've been going through something personal as well, and I thank you for your courage in sharing that, and hopefully helping people kind of get some more awareness and like I said, some strength as well.
Yeah, thank you so much for that. Yeah, it's been an interesting process being very kind of public with the information, but it's also kind of freeing as well. And yeah, for my hair patients who see me in the office, I think they have a different level of comfort, you know, because they know that I have my own kind of saga about it. So yeah, it's been cool, and I think it's a great platform to reach lots of people. Everyone has a story to tell, so I just try to tell mine, I guess.
Isn't that the truth? I think,
Yeah.
we live in a time where I think people want to hear about the real things that are happening to us,
Yeah.
And so it's interesting. Actually, my family and I actually have a reality show.
Oh, wow.
It's not too, crazy controversial, but it's
Yeah.
really the same thing where we're sharing the reality behind our lives. M Beauty Clinic, which is the clinic that I founded, is
Yeah.
really a family affair. So
Okay.
I have my siblings working with me
Oh,
as
cool.
nurses. My husband works with me, and so
Yeah.
people are interested what the dynamic is, and so we share that as well as obviously our kids and
Hmm, hmm.
what goes on with that.
Yeah, that's fantastic. Yeah, when I was looking on your website, I noticed a lot of people have the same last name, and I'm like, oh, is this just a coincidence?
Yeah. Nope, not coincidence.
Yeah.
It's called All in the Family with Dr. Tess. So we're all
Wow.
in the family.
Yeah, yeah, I'll definitely be checking that out. That's awesome. Yeah, good for you. I mean, I think it can be in some ways like really beneficial to work with family, but other times it can be complicated. Like my wife tried to help me, you know, at times in the actual office on random days, and it didn't work out as well. It's just, you know, your character changes a little bit, I think, when you're home versus at work and the roles, you know, you play. So we found it challenging, but she definitely helps me in other ways that are like more remote, I guess, you know, and behind the scenes. She makes these little gifts for patients so that after their surgeries they go home, usually not right after, but because they can't really think about anything other than just like
Yeah,
getting out of the
right.
office. But once they come back for suture removal, usually I'll give them this little kind of a small little kind of gift basket that she puts together for them. So I always mention her. I'm like, yeah, my wife
Awesome.
made this, and they love it. So it's
And
nice.
that's awesome, and that's really part of what we do, right? It's really taking care of the patient. Obviously, the procedure is a big part, but there's so
Yeah.
many other parts in really taking care of our patients and how that interaction actually helps the end result,
Yeah.
and your relationship with your patients and the kind of care that they get and the feeling that they get, that connection obviously helps with their healing and their end result.
Yeah, 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 for sure. And I think people can tell the difference when you're doing this sort of for, like, I guess the right reasons. Like, I think we're super passionate about our jobs, and we got to this, you know, this kind of industry and to the aesthetic space for, you know, for what I think are probably more of the right reasons, just really loving it, wanting to see people lead better lives by enhancing their aesthetics. Whereas there are some in our industry that maybe are doing it for other, you know, reasons, make money, to, you know, I don't know, get fame, whatever it might be, I don't know. But I think most people can see through that. And then it's also the folks that we attract, you know, are those who can appreciate that. So I think I'm happy doing it in this way with like love and care.
Yes, and I've been in practice now for almost 20 years.
Wow.
And so I was just talking to someone that we were really lucky, and I really believe what you said, that like attracts the same people, and so we are so lucky. We have the most amazing, loving, caring people. We hardly ever see patients who are kind of have unrealistic expectations
Yeah.
of psychiatric issues and all of that. And so I love what I do, and I feel very blessed to be able to do what I do.
That's amazing. Yeah. And I definitely wanted to pick your brain about sort of like innovation and sort of latest technologies and how that plays into your practice, because I just feel that there's a lot of influence and sort of persuasion in the industry to constantly do something new. And I like technology. I think it's great a lot of the times. And, we all want to see, I think, advances. But there are times when, especially when you're doing the stuff on people's faces, that you kind of want to see it tested properly and not just sort of just sold, and now everyone's getting the latest thing, and who knows what the side effects are in 3 to 5 years or whatever it might be. So I'm constantly sort of wrestling with that, like, do I get this latest laser or whatever the latest thing is, versus like saying, oh, let other people try it, and then when it's deemed safe, I'll offer it to my patients. So there's like a lot of themes and issues, I guess, about that. But if there's anything specific that comes to mind, feel free to share, and then we can get, I guess, into some
But
specific.
definitely, I think that comes, I think, with age, and like I said, I've been in practice for 20 years, and I've always been really always looking for the cutting edge. And so even, when I started practicing, we actually, radio frequency, that whole concept of radio frequency was just being introduced.
Mhm.
At the time, anyone like me with skin of color actually were excluded from having any real treatments, because the types of energies and technologies that we were using were not really safe for skin of color. And so I've really seen that, that
Mhm.
expand the ability to treat all skin types, utilizing radio frequency in combination with energy-based devices, whether that's laser or other types of energy-based devices. And then now, obviously, radio frequency is not just applied on the surface of the skin. We do it, subdermally now as well. And so now it's kind of coming out of residency. Now you take for granted that we now have technologies that treat all skin types. We now have technologies that, can be used on the surface of the skin, subdermal. Also, there's a huge expansion in combination procedures.
Mhm. Mhm.
Obviously, I was one of the first doctors that actually looked into the use of combining energy-based devices and radio frequency, so we can use it on skin of color. The other combination types of procedures that we started using maybe 6, 7 years ago is combining the use of growth factors from platelet-rich plasma
Sure, sure.
after some type of skin resurfacing, whether it's laser or fractional radio frequency, and then combining that with microneedling.
Right.
We actually created a treatment called our time machine procedure.
Okay.
And the time machine procedure essentially is that it's the combination of these incredible technologies that can be
Mhm.
used individually. Obviously, you can do laser resurfacing or whatever one you pick. Right now, I say, all of them really work,
Right.
right? If you're using a fractional radio frequency device, all of them work.
Yeah.
Really, in the finesse, the artistry of the operator, really, that
Yes.
creates the results. And then this whole field of regenerative aesthetics, which I'm very much involved in,
Okay.
utilizing platelet-rich plasmas, growth factors, and then adipose fat-derived regenerative stem cells, and that combining that with your tried and true energy-based devices and microneedling has been really magic, and that's what we do a lot at M Beauty.
Right, right. No, that's great. Thank you for that summary. Fantastic. Someone asked here, at what age should you start to, do you recommend starting these treatments?
I don't know about you, Gary, but I tell people it's really the concept of prejuvenation is
Hmm.
out there. I think the younger people are more educated and
Yeah,
informed more than ever, and they
sure.
don't want to look old. They don't want to allow the natural aging process, and we have so many tools. So I would say once you start looking at your skin and you're seeing
Hmm.
anything that doesn't make you happy, whether that's discoloration, larger pores, obviously acne, fine lines, you can go in to see your, dermatologist, plastic surgeon, and there's so many different tools. And, it's really a
Right.
huge armamentarium of tools now that we have. That's why it's really fun.
Yeah, no, for sure. Are you using any growth factors that are sort of standalone, like the fibroblast growth factor that, doesn't come from PRP, but just kind of off the shelf? Are you incorporating anything like that into your treatments?
Yes, so we were working with exosome products and other topical skincare products that contain
Hmm.
growth factors. Growth factors is has kind of exploded. That whole entire field has exploded,
Yeah.
and so absolutely we try to use it. Obviously when patients come in the treatment, we draw their blood, we harvest their growth factors with platelet-rich plasma. We apply it on the skin, we inject it
Hmm.
subdermally, and then we can apply the exosomes. There are also masks that
Hmm.
do have growth factors, and then when they get home and once their skin is healed enough, then we recommend some growth factor products.
Right. Okay. Very interesting. And then someone asked here about fat-derived stem cells. Where are you getting the fat? Where are you injecting the fat?
So 3 years ago, we created a first ever brand for adipose derived treatment, and it's called ALMI, Autologous Lipocyte Micronized Injection. And we actually trained many doctors for this procedure. And essentially, we harvest it from the patient, and that's what's really
Mhm.
cool about it. Fat is great because patients don't they volunteer to have some fat removed, all done under local anesthesia. It's very simple. We use a syringe, a little cannula, a tiny little opening that doesn't really leave any scars. I harvest it so it's fresh, and then we size it down. There's different ways to size down and kind of purify the fat so that it's not lumpy. It's very homogeneous, and we're able to use tiny cannulas, almost the same as what we would use when we inject, your hyaluronic acid fillers, or
Right.
maybe slightly bigger. And we inject it everywhere where we would want to revolumize. A typical area
Mhm.
is kind of the lower face because we do lose volume, as you know, Gary, here, lateral cheeks, the jawline, the chin,
Yeah.
obviously the cheeks, around the mouth. And micronized fat can even be injected in the tear trough area, even in the lips. So it's really a wonderful product. And the nice thing is we're not just volumizing, but we're also using the stem cell benefit, and you get
Right.
anti-aging benefits from that.
Right. So with the micronized fat, are you using it to the same, like on the same scale as the nano fat, or is that kind of, 'cause that term gets thrown around a lot as well.
Yeah, so we definitely use nano fat, and then we for structural fat we use what's called micro fat,
Right.
slightly larger,
Yeah.
sized adipose, and that is injected deeper, and then we can layer it with nano fat. The tear trough area, I only inject nano fat in that area, and obviously the lips and fine lines, you can inject nano fat.
Absolutely. Yeah. Yeah. Sometimes people ask me like, well, how much fat, do I need? Do you give them like a ballpark, or do you say, well, we just have to get the same amount in everybody and then we'll see what we need on you? Or how do you kind of estimate for them how
Yeah,
much fat?
as you know, everything has to be customized. Depends
Yeah.
on the patient, depends on how much volume loss they've had. Also, many times during the same day, we will do our time machine procedure. So then we have access to the nano fat that can be microneedled on the skin after the resurfacing. On average, I would say it's around between 20 to 30 cc's of fat that goes back in there. And so for those who get the hyaluronic acid fillers done, you know, each of those syringe is 1 cc. So we basically are transferring about 20 to 30 of those equivalent. So it is a more economical way to do more global revolumization than, say, paying for each of those hyaluronic acid filler syringes.
Sure, yeah, that makes sense. I just saw a patient back by video. I did a fat transfer to her forehead, which was kind of interesting.
Did you use nano fat?
No, I didn't use nano. I just used basically a micro kind of fat. I think it was down to maybe 1.4. And it was like, yeah, I think a 20 gauge syringe we used from Tulip. And yeah, I mean, she just had some basically just lack of kind of contour going from the central to the lateral forehead. It was sort of a drop off. So she just wanted to be smoother. And so like kind of an interesting little targeted use of fat, and it's held up so far. It's been about 4 or 5 months, something like that.
Yeah, so I tell patients that whatever they have at around 3 months, that's what's gonna stay. As you know, there are definitely patients who are fast fat metabolizers, you know, the ones who are super lean.
Yeah.
So I do warn them ahead of time that their fat may not really last. The best patients, I don't know if you agree, the best patients are really younger patients that still have good volume. And then, like you said, just localized areas of volume loss. I feel they really do the best with fat transfer as opposed to someone older who's really volume depleted. And for some reason, you know, for some reason, the fat just doesn't want to stay.
Yeah, I agree. I think it's important to have some structural integrity. And older patients, you know, they're not just losing the fat from the fat compartments, but it's the muscle loss, it's the bony loss that just everything just, you know, there's no support there. So it all kind of just sags. And yeah, so
Then
I
we have to
totally
send
agree.
them to our plastic surgeon friend. So, so
Yeah,
yeah,
that
you
was
know, one of
actually
your
one of,
questions, when do you refer to a plastic surgeon? You know, I mean,
yeah.
anytime. So when I do my consultation, I really want this to be a time where patients are educated about their different options. And surgery for, you know, a lot of the patients I see, the majority of my patients are over the age of 40. And so for many of my patients, surgery can be an option, although obviously many patients are looking for non-surgical
Of course.
options as long as they know, and I've educated them about realistic expectations of what they're going to achieve with non-surgical approaches versus surgical approaches. And so just like today, you know, I had a patient who I saw in consult, and she had some, she's postmenopausal, she had some unwanted fat, she's very lean otherwise around her hips, her outer thighs. And then she's like, oh, I have a lot of indentations in my buttocks, and I feel like my buttocks have deflated and, you know, kind of drooping. And so then I really talked to her about, okay, maybe some lipo and then fat transfer, but which I don't do the Brazilian butt lifting procedure, fat transfer. So then I referred her to my partner, Dr. Tim Nevin, in my Beverly Hills office for that procedure. Patients who come in to see me last week, there was a patient who wanted her abdomen to be, she's like in her late 50s, wanted her abdomen to be smoother. She had some fat pocket, but also a lot of loose skin just from aging. So this is something that my partner, who's plastic surgeon, Dr. Nevin, and I kind of evaluated the patient and decided, okay, is this a tummy tuck type of a patient or something like a Renuvion J plasma device, you know, subdermal radiofrequency treatment done under local anesthesia, which I perform. Will this be enough, and will this achieve what the patient wants?
Yeah, no, I think that's fantastic. No, I guess what I was getting to with like that question that I posed, that was basically that, like, I think that these days it's hard to be the jack of all trades, you know, and a lot of people are not pretending to be, but, you know, trying to offer as many treatment modalities as possible in their clinics to kind of retain patients. And, you know, that's okay to some degree, but then I feel like it's okay to say also that there's another specialist in town who does more of this type of work and would be a better fit for you. So I've actually enjoyed building my practice that's about, you know, 2.5 years old now, on just like focusing on specific procedures, and things that I don't do, I'll refer out to colleagues. And it I find that it's better patient care ultimately than just trying to
100%.
buy up every instrument, go in every course, pretending like you're the expert in every little thing. It's just, you know, because you can never get to that level with everything. It's impossible with with all the
I
different
totally, I
technologies
can
out there.
agree more. I really think that we have to, one of the signs of maturity is knowing your, limitations, and also being honest with yourself and what you're good at, what you're really passionate about. Because
Yeah,
usually what you're passionate about, that's what you're going to be really good at. And so also, it's just, there's certain things that being a dermatologist, I wouldn't feel comfortable doing, right? One of the things that I refer out, if people wanted fillers in their under eyes or temples. I just don't like doing it. And so I know a lot of
yeah,
people who, a lot of doctors who would do that. And so I would just refer out. I told you about the Brazilian butt lift
of
procedure,
course.
fat
Yeah.
transfer. So I think that's really important. And I think that really does build, trust with your
Mhm.
patients as well. I think they like to know that you care enough to, and you're honest enough to know and
Yeah.
to tell them the truth.
Yeah, that's most of the time that's all they want, you know. They don't want to be coerced into something or tricked. Oh, like I didn't know it was gonna. So I go through risks and benefits, and whether it's for something like filler, and most of the time people have had filler before, they're like, "Oh my God, I didn't know that could happen," and I'm like, "Yes, that
Yeah,
could happen," because it's like if I'm gonna give them surgical risks, you know, you bet that I'm gonna give them all the non-surgical risks, that they're always there. So I feel like as long as, you know, it's kind of more of a pact, like I'm going to try my best, and this is what we're, you know, kind of aiming to do. And if they are willing to accept the risks and also the potential reward, that those are the types of people I like to deal with. Because the others who don't want to hear of anything and, oh, don't scare me, don't tell me, it's all well and good until they're one of those kind of rare complications, and then you're dealing with a whole other problem.
right. And I think, when you are starting off in your practice, and I think you tend to be maybe bolder, and you're really smart to
I'm
kind of do
conservative about
business.
things.
Yes, but I think in general you tend to be bolder, and then as you get older, and maybe you've also encountered some, and you've heard of
Right.
complications that colleagues have had, then you're like, whoa, maybe not. And so it's one of those things where I also am very, very conservative in what I do. And
Sure.
that's why I love the regenerative aesthetics
Yeah.
practice, because, I'm very much an expert in skin resurfacing, and then utilizing our patients' own growth factors and stem cells. It's like, you really have very little potential complications. You can
Right.
still be artistic. And so that's what I like about it. You get really nice, incredible results with it.
Yeah. No, that's fantastic. Really, really nice. So, how do you decide which procedures you perform yourself, Dr. Tess, versus delegating out? Because I know you have a pretty big team, and so you know, which ones would you say like I'm gonna be the only one who does this, versus saying like, oh, like please, like let me teach my MA to zap away with this, you know, tool. How do you
I think it was
decide
the
that?
hardest. That was the hardest decision for me, because really, really care about my patient's results. I can't sleep if I think, I'm that kind of person. There are people
Yeah.
where they're like, they can, they don't think about it. They're not obsessed about it. And so the only two people that I delegate procedures to are my siblings. So my two siblings, they're my younger siblings, so they
Okay.
listen to me. I train them. They're used to taking, directions and orders from their big sister. So my brother Rick and my sister Angela are both, RNs in the clinic, and they're really the only ones. And same thing, like my brother doesn't feel like he wants to do fillers. He doesn't feel comfortable, so
Yeah.
he doesn't do that. He does skin treatments. He does, your Botox treatments and PRP injections. That's it. My sister does fillers and everything else. I'm the only one that does the liposculpture, J
Okay.
plasma, fat transfer, CO2 skin resurfacing. I do not delegate. So I do all of those. So yes, it's really the only time I was really comfortable is knowing that they're not going to like go against what I told them.
Yeah.
And
Yeah.
I personally train them. And so there's no ego issue there.
Yeah, no, that's good. Yeah, I'm the only child, so maybe I can like pull in my in-laws, my sisters and
That's
brother-in-law.
harder.
My brother-in-law is actually applying into derm right now. He's
Really?
at Albert Einstein finishing up med school, and so he took a year off, did some research, and I think he has a pretty strong chance. He's done well on his
Yes.
exams and all that. So.
It's crazy. Dermatology is one of the most competitive fields to get
Sure.
into. And my daughter is a senior at Stanford, and she's
Uh,
right now applying to med school. And so I don't even know if she'll
Good luck.
get into derm, So we're praying that she gets into a med school. And it's interesting that you would think that with COVID that there'll be less applicants to med school, but this year, my daughter says is really a record-breaking year for the
Oh my
number of.
God. Wow. Well, even I think for like our practices, I don't know about you, but I feel like just in general, right? I mean, the aesthetic space has gotten like more popular since this whole thing hit. And I mean, I have some of my theories, like I think maybe, all the Zoom calls, like even now, like I'm like seeing you, but
You're watching yourself
I'm
all
seeing
the
myself
time.
and of course all these imperfections but that I'm mostly okay with. But still, like a lot, if you look at yourself enough, you're gonna start to see things. I think that's one. I think we can recover at home. Some of us,
That's I
who
think
have home jobs.
I think that's the big one, Gary.
Yeah.
We have this treatment that is becoming very popular we call this Sublimax. It's plasma energy that essentially works through the process of sublimation. We use it a lot for the eyelids, and it's kind of a non-surgical blepharoplasty that we do. And the downtime, the patients have scabbing for about a week, sometimes longer, and then but people are okay with that now.
Yeah.
Before in California, where I practice, it's like 2 to 3 days is too much to ask for.
Yeah.
But now they're like, just hit me hard. I don't, I don't care.
Yeah.
I
No,
have
it's true. Yeah, the recovery. Yeah, I mean, I do a lot of these lip surgeries, and my patients are like, "Oh, this is great. I can just keep my mask on and just recover, and no one knows." So it's a
exactly.
lot of benefits. So with all these like new technologies, the radio free, everything we talked about, all the stuff, is there anything, even maybe not the most modern tech, but even like maybe over the last 10 years, some technology that there was all this hype about, and maybe you even had it in your clinic or whatever, and now you really just don't ever do it, patients weren't happy with it, anything like that, things about like certain technologies from over the years, like Althera, that a lot of people didn't like ultimately, but I don't know, anything like that.
Well, we always have to really be able to assess for ourselves. And really, doctors, have to be careful about falling for marketing hype.
Right.
I've done a lot of work with manufacturers, and also done marketing on the other side as well. And
Mhm.
there's definitely devices that should not be popular if you're looking at efficacy, tolerability, but because companies have done such a good job marketing it and have
Yeah.
made it a household name, everybody asks for it, and then doctors feel compelled to buy it for the business side. And I
Mhm.
tend to not be one of those doctors. And I'm sure I've missed a lot of revenue because people
Mm.
have come in and
Yeah.
asking for, Althera. I never bought Althera. I never
Nice.
bought Thermage. There's a lot of technologies that are household names that I really
Mhm.
never believed in. And I felt like there are other technologies that would offer my patients better results.
Yeah.
And I'm all about really giving my patients the very, very best results. And I evaluate technologies on my own, and I don't really care which KOL is behind it. I have to try it myself, try it on the patient, look at the science, and then decide whether it's something that I feel it's worth bringing into the practice. And so the good news is that over the last 20 years, I don't have that experience where I felt like, oh man, that was just a marketing hype. And so I'm happy to say that every single piece of equipment we've purchased so far has really been incredible and has really delivered.
That's really nice to hear. Yeah. I mean, yeah, clearly your patients are very happy. And like I said, your reputation is just so good. So yeah, I mean, I guess it's just about making those right decisions that are not just, for the practice's bottom line, but really ultimately, like, is it going to make your patients happier? Are they going to be safe? And then, kind of recommend it to other people. I mean, that's
right.
That's
And,
such a big part of
we have a type of practice. It's incredible. I've been in practice now for almost 20 years, but
yeah.
it's really, a lot of my patients have become my friends, and really you're starting your practice. And so I know that you are forming these incredible relationships with your patients, and just thinking long term. Sometimes you feel pressure because colleagues or practices around you is offering something that you see on TV and you hear about it, you see in magazines, and sometimes you're like, am I the dummy? But in your gut what is the right thing to do. And over the long term, you do end up building a great reputation, because when patients hear that you have it, they know that it's something that will work. And same thing in the industry now, even other doctors, they know that if I bought it, if I bought it, that means it probably really works. So,
right. Yeah.
I
No,
don't buy things.
that's a really good point. Yeah, I just find that there are certain technologies that I trust but just don't carry because I have a small sort of boutique practice and I can't, like, do everything. I'm
Yes, and
too
you have
busy
to
doing
be
other things.
careful. You
Yeah,
have to be
but then,
careful with
like,
that.
but then I'll at least, know about the tech because I, will have seen it at conferences or talking to people like you. And then I'll just recommend that, my patient go see someone literally like down the street or sometimes in our own building. There's just so many doctors around here in Manhattan who offer a lot of this technology. And it's just, I feel like it's okay for me not to have it. If I was in the middle of nowhere, then sure, maybe I'd buy up more things. But then there are things I just kind of sometimes will talk people out of and give them reasons why or tell them about some other patients' experiences. And Althera comes up a lot. I hear a lot of complaints. Maybe that's why they are coming to me, but it just seems like at least there's this community online of people who feel like they've been damaged by it and are trying to kind of get their old face back.
No, I definitely, unfortunately, have done consults with patients who've had similar types of bad experiences, and try to talk to them about how they can reverse. Sometimes they've had fat atrophy. Then we think about either fat transfer and
Right.
maybe even platelet-rich plasma to try to remodel some of the scar tissue. So I think it's smart for you to really find your niche. And then you kind of just be the expert in that, be the guy for that. You have to be careful about, especially the beginning of your career. And I've made that mistake in the very, very beginning where I didn't even know. It just just signed up for a big chunk of money for buying equipment, which turned out to be incredible technology, and it was fine. But thinking back now, I'm like, whoa, that could have gone. that could have.
It's a risky, yeah, these are big investments and for sure. I mean, my first and one of my only like big pieces of tech in the office is AccuPulse CO2. Just because I wanted to get it, from when I started my practice, but I couldn't afford one. I just knew it was going to be a workhorse and something that I would carry for a long, long time. But yeah, it's just not, I started my practice like bare bones, just with, some instruments and, a couple of syringes, just whatever, like the minimum that I needed to be able to work my skill set. And I've just kind of grown kind of incrementally from there, but I've enjoyed doing it that way. as opposed to just like a massive investment early on, having everything to offer, but no one kind of knows your name and no one, you know, whatever. It's worked for me. I mean, 2 years in, I feel like I already have at least some sort of reputation locally, and I have people coming in from all over for the lip surgeries and now more and more for hair. So yeah, I think you're right. I mean, especially in the competitive markets like that we're in, if you start with like a kind of a niche and build on that, it really helps. Thanks for kind of paving the way for some of us like newcomers.
No,
You know,
I
the
think it's
aesthetic space
exciting.
is so interesting, you know, and there's so much to it. And my biggest thing is like, how do we advance it, yet keep people safe and offer like effective treatments, you know, because there's a lot of room for just sort of voodoo and people being taken advantage of, and that sort of bothers me, you know?
Oh, definitely, definitely. That's one of my frustrations. I think now with social media,
Yeah.
sometimes the doctors who are not really the best doctors end up, you know, being the most popular doctors. You know what I mean?
Yeah.
And then people start doing things that they'd recommend, and it may not be, like you said, the safest or the best for the patient. But then there's that marketing power that you can't ignore. And that
Yeah.
happened a lot, like I said, throughout my 20-year experience. Technologies where it's like, oh my God, I know it's fake. I know it's just marketing hype. Yet, you know, you hear patients go through it, and then I see them telling me, oh, it didn't work, and I'm like, yeah, well, because it
Yeah.
was not gonna work.
Right.
So I mean, the advice to the people is really also, you know, just be careful and don't believe everything that you see.
Yes.
And do your research, and if it does sound too good to be true, sometimes it is. And you know, people, I think you're a surgeon. People
Yeah.
really want to avoid having surgery, and sometimes in that effort of trying to not have surgery, sometimes they end up wasting money and
Yeah.
wasting time on non-surgical procedures that really are not going to work.
Right, right. Yeah, no, for sure. And I find that with hair quite a bit, especially with women's hair, actually, because there are plenty of people who could benefit from a hair transplant. Obviously not, you know, all women or all men, but there are lots of people who would, and it's much more cost effective than continuing to do PRP forever or, you know, just sitting on some supplements that have limited efficacy. So those are all well and good, and sometimes it's a good, you know, kind of added bonus. But there are, you know, times when you just have to, not have to, but you can pull the trigger on a transplant and give someone a much more, you know, excellent result that's going to be with them for a long, long time, and a result that they can't otherwise get with any other method. So yeah, sometimes I find people who come to me for like non-surgical, just hair restoration. I'll end up trying to talk them into surgery, not because I'm trying to sell them on surgery, but because I really think that that's what they need. And then I have, you know, my other kind of category, especially younger men, where they're not good surgical candidates. I mean, they just, you don't know what their pattern will be. You know, they're kind of thinning, but not necessarily receding yet. And some actually women too, where it's just kind of a global thinning and they
Mm-hmm.
want a transplant. And I try to explain it to them that I can't just add hair diffusely everywhere and have it be a good outcome, and that they're likely going to be thinning in the back or the donor areas. So yeah, it's just, I think it's about just educating and trying to do the right thing. Like, you know, sometimes people really want one thing and they're fixated on it. And my favorite types of consultations are when people, like when I see it on my schedule and it's like, this person wants to talk
Already
about
said.
like aging.
Yeah.
And I'm like, oh, this is cool, you know?
Yes.
Or like their hair. Like I actually prefer those over like this person wants this specific surgery and you know, that's what they think they need. And because sometimes I end up talking them out of it.
We also have a hair restoration practice, and I really feel that has to be customized, you
Yeah,
know, because like you said, you have to really evaluate what's going on.
right.
Is it a global problem? Is it, you know, is it a localized, just no hair and you're gonna need a transplant? Many
Yeah,
times, you know, we do talk to them, even if they're gonna go and have a hair transplant procedure, that, you know, if they are willing to do it, going and having regular platelet-rich plasma injections can help save the rest of their hair, you know, and then keep potential donor sites from basically going away in case they do need multiple hair transplants. And some people, as you know, need them. My husband has had hair transplants, so my brother, who's a nurse, also had it, and we are very passionate about hair. And I recently just had my PRP treatment.
Nice.
I had adipose derived nano fat as well.
Very
For
nice.
my hair.
I've only started to do that for scalp. That's interesting. So you guys have been doing that treatment for scalp?
Yes. So
Very nice.
the nano fat treatment for scalp, I was one of the first doctors to really, you know, talk about doing that, and it's pretty amazing what we can do with it. And you know, like I said, it's a simple harvest, and it's really good for, especially for women. Or men, where it's more of a global thinning. And you know, you're trying to figure out, okay, maybe let's do the Almi Nano Fat hair treatment first, supported with PRP treatments, and then let's wait about 6 months to a year, see how much hair regrowth we get, and then we can decide at that point. Some patients, it's going to reveal itself. There's certain just localized areas where we do the transplant and then they have incredible hair. So that's kind of what we do. And so I definitely urge you to keep going with the nano fat.
And you know, there are studies to suggest that, especially in scarring conditions on the scalp, that, you know, you could still potentially transplant. You just have to usually wait for it to kind of stabilize, you know, the whole kind of disease process. But doing that nano fat transfer first, you know, and waiting 3 to 6 months and then doing a transplant, it's like a healthier bed for the follicles to then grow in. So it's right up. I'm sure you've been doing this way before people have been writing about it.
The data for like cellular regeneration when we inject nanofat in skin is amazing. I mean, so if you kind of extrapolate that for scalp and the hair follicles and the cells that are needed there, and the vascular component as well, I think it makes sense. And the results that we're seeing, because again, I've been doing this now for at least 3 years, so I've seen the patients come back. They've really all been happy with it. And you know, obviously when I first started it, I kind of wasn't promising much to patients, which is always a good thing. Over promise,
play it down.
Promise, over deliver, right? Always under promise. But we've all been pleasantly surprised. Actually, one of the first patients that we did is my medical assistant's brother. I was teaching a course, an ALMI course, and we treated him, and he's in his mid-20s, but had significant hair thinning, front and crown area. And we did his procedure. It was the demo for the doctors. And then within a year, it's like the whole thing is filled.
That's incredible.
Yeah. Wow. Obviously, like, you know, if I show you, he's like one of our best before and after. I tell people, it's like, you can't expect that, but
cannot be replicated.
That's like amazing, right? Before there was no way that could happen without a transplant.
That's
and
true.
So these are incredible times that we live in, and so the whole regenerative aesthetics. I'm part of a group called San Diego Academy of Regenerative Therapies, and maybe next year you can come to San Diego, Gary. And so I am the director for the Regenerative Aesthetics program there, and these are the types of things that we cover.
Yeah, this is great. Yeah, I mean, Dr. Tess, you're clearly an innovator in this space, so really, again, applaud you on everything that you're doing and just continuing to offer all of your patients. What's the best way for people to get in touch with you and your team if they want to, you know, either do a video, or I don't know how you're doing the consultations
so
now.
we're doing, I'd say 99% of our consultations now virtually, you know, FaceTime or Zoom, and we do offer free consultations. So,
nice.
you know, so you can call the clinic at 1-833-462-3288, and that's 1-833-4M-BEAUTY, or go to our website, M Beauty Clinic, where is it? M Beauty Clinic, mbeautyclinic.com. mbeautyclinic.com, and I'm on obviously Instagram at Dr. Tess Mauricio. You can message me, and I'm very good with answering those messages. And it's really like you said, you know, it's all about educating. Really, no pressure to have your procedures with us. We just want you to know the options.
I really appreciate just the honesty and humility that you show, especially after, 20 years in practice. Some people have very elevated views of themselves and, compared to those around them. And you've managed to just stay super cool. So thank you for
Thank
that. Good
you,
luck to your
Gary.
daughter. I'm sure she'll do really super well
Good luck
in
to
the
you,
applications.
and yeah, good luck to you. And if you wanted to do the nano fat for your scalp, you know, let me know. I'm happy to do that for you. So
Yeah. Thank
yeah,
you. Thank you. I feel like a lost cause, but maybe.
you never know. You never know. You know, I think
Yeah,
it's something
that's
worth
true.
trying for sure.
Yeah,
Don't
for
give
now
up.
I'm doing the allergy shots, trying to kind of reprogram my immune system a little bit. So,
Well, another thing that we have been doing is IV therapy, adipose-derived regenerative stem cells, but
okay.
giving it IV, and it's really incredible for treating and normalizing patients with autoimmune diseases
Okay.
or allergies, and so that could be something to consider.
Yeah.
I'm part
Inter-
of a group of
hmm
providers. It's called Regenerous Medical. So you can look it up,
Yeah.
regenerousmedical.com.
Yeah. I'll
And
definitely look into
essentially same harvest some adipose,
Yeah.
and then it's processed in a different way. And then we collect your cellular stromal vascular fraction, as
hmm
opposed to the nanofat, it's tissue stromal vascular fraction. And that can be given back to you IV. And
Okay.
then your cells, millions and millions of your cells will be inside. And, you know, this is an autoimmune
Yeah.
condition, whatever is going on. Hopefully will mitigate it and be
There is hope. There is hope.
yes.
Awesome. Thanks so much again, Dr. Tess. I really
Okay,
appreciate your
Gary.
time and expertise. And yeah, hopefully we'll be in touch, okay? If you're ever in New York City, come stop by.
One of my favorite cities. I definitely will be there sometime when we can.
Yeah, for sure, for sure. When this is
Take
all better.
care.
All the best. Take care. Good night. Bye bye, Dr. Tess.
Bye.
Bye.
Bye,
See you.
everyone.
Bye, everyone.